you are less than 60, you might look at yourself as a person who is at greater risk for prostate cancer and arrange to get checked earlier. So those are the two risk factors for prostate cancer: men of a certain age, family history, and also, unfortunately, our race, being black or being of African ancestry, is also a risk factor for prostate cancer. Whether you are in the US, whether in Ghana, whether you are Caribbean, wherever you are black. As Peter Tosh said, whether you go to Church of God, you are still an African. This may also have something to do with our genes. So being black is another factor, a risk factor for prostate cancer. These are the three factors that have been established as risk for prostate cancer: men of a certain age, family history, being black, or being of African ancestry. Other risk factors have been looked at, but none has shown a conclusive link to prostate cancer. These are diet, smoking history, chemical exposure, inflammations of the prostate called prostatitis, even STDs like gonorrhea have been looked at, but none of these have been shown to have a direct link to prostate cancer. Another thing that has been looked at is vasectomy, where men have had surgery of the vas deferens to make them non-productive so that they don't have children. They've had vasectomy. It was thought some time ago that having a vasectomy may be a risk factor for prostate cancer, but this has not been proven to be the case. At this juncture, brothers and sisters, I want to point out something. I want to stress that we men have to be particularly serious about our health. Women do well, but a lot of men who I see in my clinic say they haven't seen a doctor in 10, 15, 20 years, and they feel good about it, deceiving themselves that all is well. But all is not well, because there are diseases which start silently in the body and cause damage without warning. Prostate cancer is one of them. It can be very silent in the early stages, but when it progresses, it will eventually let you know big time. How would it let you know? In other words, what are the signs and symptoms of prostate cancer? These are as follows. But let me say that early prostate cancer usually causes no symptoms. When it is early, when it is small, just started, it causes no symptoms. But when it is advanced, it may show up in various symptoms. As I indicated, because of the location of the prostate to the bladder, most of the prostate cancer symptoms tend to be related to the urine. This includes a slow or weak urinary stream, or the need to urinate more often, especially at night. Others may also have symptoms of blood in the urine or semen. Blood in the urine or semen is a symptom of prostate cancer. And having trouble getting an erection may also be a prostate cancer symptom. Pain in the hips, pain in the back, pain in the ribs, or other areas also may be a symptom of prostate cancer, which has spread to the bones. Weakness or numbness in the legs or feet, or even incontinence of urine and stool from cancer in the spine is also an indication. Weight loss is also a symptom. Losing weight without even trying is a symptom of prostate cancer and other cancers. Feeling very tired is also one of them. But note that these symptoms can be caused by a number of other diseases. But it's important to tell your healthcare provider or your doctor if you have any of these symptoms so that the cause can be found and treated What would your doctor do when you see him? What is he going to do when you go to the doctor, complain about these things that are listed above? Complaining about trouble urinating, complaining about pain in the bones, weakness in the legs, or even incontinence of urine, feeling tired and losing weight. What would the doctor do to you? He would do certain things before he can arrive at the right diagnosis. He will first seek some details about your symptoms, then he would ask about your medical history to learn about possible risk factors for prostate cancer, such as your family history of prostate cancer. Then, after the history taken, the doctor would examine you. This is called a physical exam, or physical for short. He will feel your abdomen for abnormal swelling or tenderness. He may also do a rectal exam by inserting his lubricated gloved finger into your rectum to feel for the prostate, which, as I pointed out earlier, is located below the bladder. But you should also know that the prostate sits in front of the rectum. The prostate is in front of the rectum, and it can be felt there. So the doctor putting his finger in your rectum and pressing against the wall of the rectum can make him feel the prostate. This is called digital rectal exam, or DRE. He will do that for you to check your prostate. After taking a history doing a physical, he would also order some blood tests. The blood test that we are interested in the most for prostate cancer is a blood test called PSA blood test. The PSA stands for prostate specific antigen. PSA is the short form of the long name, prostate specific antigen. PSA for short. This test, this protein is found in the prostate, but a small amount finds its way into the blood. And that's how we can check the blood and measure it there. Is the blood PSA test that we depend on initially to diagnose prostate cancer. If the PSA is more than 10 nanograms per milliliter, the chance of having prostate cancer is over 50%. If the PSA is less than 4, it's unlikely to be due to prostate cancer. Note that PSA is not specific for the prostate cancer. A high PSA may be due to a benign condition like inflammation of the prostate. So it has to be done when there's no suspicion of prostatitis or urine infection. Otherwise, the PSA may go up and confuse everyone, thinking that you have cancer when you do not have prostate cancer at all. So you have to be careful when the doctor asks for PSA test for your prostate to find out if you have prostate cancer. You should be careful when you do the PSA test. Make sure that you don't have any urine infection. And also for 3-4 days, preferably a week before you have the PSA test, abstain from having sex. Otherwise, the prostate will be irritated, as we indicated before. That is where some of the semen comes from, the prostate. So it might be irritated, and the PSA may go up and confuse everyone as if you have prostate cancer, when in reality, all that you did was something very benign and you don't have cancer. So ask your doctor who has ordered a PSA, what do I need to do to make sure I have a good PSA test? And he might tell you some of these things I've indicated to you now. If indeed you have prostate cancer or a suspicion of it, if the result of the PSA blood test suggests that you might have prostate cancer, you will need what is called a prostate biopsy. A prostate biopsy is a procedure in which a small sample of prostate tissue removed and looked at under the microscope. The biopsy samples are sent to a lab where a doctor with special training called a pathologist will look at them with a microscope to see if they contain cancer cells. The results might be reported as follows. Negative for cancer, meaning that no cancer cells were seen in the biopsy samples. Or the report may say positive for cancer, which means that cancer cells were seen in the biopsy samples. Or the pathologist may say suspicious, not typical or atypical. When the pathologist is not sure, he may report it that way. But if the prostate biopsy results are negative, you might not need any more tests other than a repeat PSA test and possibly digital rectal exam sometime in the future, maybe in 6 months or so. If the prostate biopsy is positive for cancer, then it will be assigned what is called a Gleason score. Gleason score. The higher the score, the more likely the cancer will grow and spread quickly. So the Gleason score tells the doctor whether he should do something right now or can delay doing something, in other words, treating it now or wait later. If indeed you have cancer of the prostate, another test that a doctor might order is imaging, MRI, CT scan, ultrasound, bone scan. These might all be used to look and check if the prostate cancer has spread to other parts of the body. If the cancer is in the prostate and has not gone beyond the prostate, we call that localized prostate cancer. Localized means all the cancer is in the prostate. It hasn't gone anywhere else. Localized prostate cancer. If the cancer has gone beyond the prostate into other tissues, if it has gone beyond the prostate cancer and into other tissues near the prostate, we call it locally advanced cancer. If it has gone beyond the pelvis, if it has gone beyond and has gone into other organs, and has gone, for example, into your spine, the bones in the spine, or even your pelvis, or even your ribs, or even your cranium, your skull, we call that metastatic cancer. It means it has spread. And I'm sure some of you may have heard that President Biden had prostate cancer. His is metastatic. Why? Because the cancer has gone into his bones. That is President Biden. He has metastatic prostate cancer. So how do we treat prostate cancer? Treatment is based on whether the cancer is localized, which means it's only contained in the prostate, or if it has spread, called metastasis. How do we treat prostate cancer? It's based on whether it's localized or it has spread. If the cancer is localized, meaning that it's all contained in the prostate and has not traveled anywhere else, there are 3 ways to deal with it. One of the ways is called radical prostatectomy. That is removal of the prostate by surgery. Getting rid of the prostate by surgery, going in there and removing the whole prostate, cutting it out, and none of the prostate tissue is left behind. It's called radical prostatectomy. The other way to treat localized prostate cancer is radiation therapy, where radiation beam is projected onto the prostate to destroy the prostate gland. The third way to treat localized prostate gland is called active surveillance, meaning that the doctor feels it doesn't need to be treated now. In active surveillance, the cancer is not treated because it is small and it is slow growing according to its imaging and the Gleason score. It is monitored carefully, and if there's any sign of progression that the cancer is getting bigger or is getting about breaking into other tissues, then treatment is offered right away. This active surveillance approach is for men whose tumors are small, are localized, and not growing rapidly. And the men who have this type of tumor have a life expectancy of more than 10 years. So those are the three ways that we treat localized prostate cancer. One, surgery. Two, radiation. And three, no treatment, called active surveillance. What about metastatic prostate cancer? Metastatic disease is treated differently. They are treated with what is called ADT. ADT means androgen deprivation treatment or therapy. Androgen deprivation treatment or therapy, ADT. Prostate cancer is hormone driven, and testosterone is a hormone that makes it grow. So the treatment is to abolish testosterone production in the body. If you are able to abolish testosterone production in the body, then you stop the cancer from growing. In the past, this was achieved by castration, cutting out the testicles. This was done in the past by surgically removing the testicles. But of course, many patients protested, and that kind of surgery was stopped. We are not doing it anymore. And now what we are doing is medications have been developed to stop the testicles from producing testosterone. It's called chemical castration. In the past, we did surgical castration, but now what we do is chemical castration. No surgical castration is done routinely now. ADT is frequently combined with other medications as well as chemo to kill the prostate cancer, meaning we do a 1-2 punch. First, we cut out the hormone which drives the prostate cancer, and two, we offer medications to kill the prostate cancer. If the patient has bone metastasis, meaning the cancer has gone into the bones, we treat the bone disease with radiation. That is how we treat prostate cancer. We treat it according to whether the cancer is localized or whether it has spread. How do we prevent prostate cancer? This is an interesting topic for you. How do we prevent it? How do we stop this thing from happening? You know how to treat, but the best thing is to do is for us is to prevent it in the first place. Prevention, as they say, is better than cure. And in the case of prostate cancer, the cure of the disease might be worse than the disease itself. That's why prevention is critical. The treatment for prostate cancer is fraught with complications. Radiation, for example, to the prostate is associated with risk for bowel or bladder inflammation called radiation proctitis and cystitis. This causes bleeding. You are cured of your prostate, but when you pass urine, it's all bloody. When you go to the bathroom, it's bloody. You've gotten rid of the cancer, but you are bleeding. That is a complication of radiation treatment to the prostate. When we do surgery of the prostate, what I call as radical prostatectomy to remove the cancerous prostate, this is associated with incontinence of urine. You have to wear diapers. And for some, surgery will damage the nerves going to your penis to cause erection. So you might suffer impotence from doing surgery of the prostate. So these are some of the things that radical prostatectomy could do to you. There are others too, but these are the important ones that we need to know for now: incontinence and impotence. ADT, as I told you before, the hormone treatment for metastatic disease, can cause heart problems and also increase blood clots in the body. blood clots, and cardiac problems. And as you know, chemo has multiple issues such as decreased immunity. So, as I said before, prevention might be the way to go rather than waiting to have it, the disease, and cure it, because the cure of the disease might be worse than the disease itself. And because the treatments are fraught with complication, we have to talk about prevention. So let's talk prevention, all right? But before we get into it, before we get into prevention of prostate cancer, let's talk about how to keep ourselves healthy. Our general well-being. Let's talk about the whole body and talk about prostate in the next few sentences. We cannot talk about prostate cancer prevention without talking about our own general well-being. What's the point of having a healthy prostate only to die prematurely of heart problems? What shall it profit a man if he gained his prostate nicely and lost his head to dementia? So, for our general well-being, let's do the following. This is a summary, okay? In another time, we can give you a detailed talk on this, but this is only a summary. The first one is eat well. Eat well. Avoid red meat and eat more plant-based foods. And when you go to grocery, try and buy organic products. Organic produce that is the produce that has not been treated with all kinds of pesticides and has not grown with all kinds of unnatural fertilizers. Buy organic. Eat well. Avoid red meat and eat mostly plants. The next thing to do to keep healthy is exercise. Going to the gym is great, but walking is good too. That's what I do. I walk. I walk in my neighborhood at least once every day. 3 times a week is optimal, but every day is also very, very good. So do your exercise. Eat well, exercise. Those of you who smoke, stop smoking. And smoking means stop smoking tobacco and stop smoking weed. A lot of people think weed or hashish or ntampi or Indian hemp is fine, but it's not. They sell it to us with the knowledge that it's not good, but still they sell it so that some of us will fall prey to it. But don't smoke tobacco, don't smoke weed. In Ghana, I was impressed that a lot of people are not smoking these days. In the US too, a less number of people are smoking, but they smoke here. In Ghana, I don't see people smoking, and that's a good thing. Don't try it if you haven't started. And if you have started, stop it. And don't drink too much alcohol. In Methodists, we don't drink anyway. The Methodists, we are told not to drink alcohol. It doesn't matter whether it's apothicain or whiskey or cognac. They are all alcoholic beverages. So you shouldn't drink too much of it. Just a little bit, a little bit is good. But so a lot of times we don't know our limit for a little bit and we go on and get drunk. That is what the Methodist Church is against. So moderate drinking is all right. But it's better to make sure that you're not overdoing it. And then another thing that we need to look out for is stress. Avoid stress. Relax. People work 3 jobs, 4 jobs. Don't work too hard like that. Work smart and make the money. But stressing yourself with a job is no good. It causes burnout. And take time and go on vacation and enjoy the money that you make. Last but not least, sleep 8 hours a day. 8 hours. That's what you must do. All right? 8 hours. 6 is okay, but 8 is good. But don't go beyond 8. That means you're being lazy. So sleep well 8 hours. At least 6 hours a day is fine. Okay. So now that we've talked about our general well-being, taking care of the whole body. Now let's talk about how to prevent prostate cancer itself. Now for prostate cancer specifically, let me say this. There is actually no prevention strategy for this cancer. Unfortunately, there's no prevention strategy for this cancer. Prevention here, the prevention that, when we say prevention, we are talking about primary prevention, meaning that we are trying to do something to avoid having that problem, doing something to prevent having prostate cancer in the first place. That is called primary prevention. But we don't have any strategy for primary prevention for this cancer. What we do have is called secondary prevention. Secondary prevention. In secondary prevention, we seek to prevent advanced stages of the disease happening. The idea is to catch the cancer in its early stages so we can impact its complications and more. The idea is to catch the cancer in its early stages so we can impact its complications and mortality. So prostate cancer prevention is prostate cancer screening early to find out if you have it or you don't have it. So at what age do you start prostate cancer screening? Unfortunately, also, the experts don't have one consensus recommendation. They don't. Some experts say this, and other experts say the opposite. There's no consensus. There are different recommendations out there, but the main issue is first discussing with your own physician about your risk status. I told you the risks are three. One is your age, the other is your family history, all right? And the third is whether you have some genetic issues going on in the family. Genes also are very important, and it turns out that some genetic issues in the family called BRCA, which causes breast cancer, can also be inherited in men and which can lead to their prostate cancer. And one recommendation for American Urological Association have stated that if you are in a certain risk category, like being Black, having a strong family history, or the presence of abnormal genes in your family, you should start screening at the age of 40. And you remember I said earlier on that prostate cancer is rare below 40. But when you have a risk for that, for a strong family history, you might actually have prostate cancer earlier than it's expected. So when you have a lot of risk for prostate cancer, the age to start, according to American Urological Association, is 40 years. If you don't have any risk, you are a man without any risk, it's okay to start at 50 if you're average risk. And according to U.S. Preventative Services Task Force, in 2018, they stated that if you reach age 70 and above, stop screening, stop PSA-based screening. This is why President Biden stopped his prostate screening, which to me was not a smart idea. Biden stopped his prostate cancer when he was 70, and he didn't screen again. And now he has metastatic disease. I think it was a wrong recommendation for him. So, brothers and sisters, I'm coming to the end of my presentation. And in conclusion, I'm going to say that prostate cancer is quite common. It is one of the cancers that kill a lot of men in this country. If found early, the chances for survival are high. Therefore, getting screened for prostate cancer appropriate for your risk group is one of the best things you can do for your health and longevity. Thank you, and God bless you. Now the floor is open. Yes. Okay. If you look at the Methodist Constitution, it doesn't say you shouldn't drink. In the Constitution, it doesn't prohibit drinking. It said don't drink, get drunk. Yeah. It doesn't say you shouldn't drink alcohol at all. Accept it. If you go to a party, maybe if you go to a party and you're a minister, you shouldn't accept drinking. If you are, yeah, if you are a European, you shouldn't accept. But if you look at what they say about alcohol in the Constitution, it says don't get drunk. Different from saying don't accept from somebody a drink. But what about if you're in your house? Should you accept a drink from your wife? Uh-huh. Yes. Drunkenness. Thank you. No, no, no. If you get drunk, then if you go to communion, you should be walking with your head. We drink wine in communion. That's alcohol. No, no. I think if you go by the Constitution and what it says, you wouldn't come to that conclusion. Uh, Drunkenness. Drunkenness is drinking to get drunk. But I'm also saying that you can drink moderately, but because a lot of people don't know their limit, it's best not to drink. I said that before. But what I'm trying to say now is if you look at what is written for us to follow, doesn't say that we should not drink. It says you should avoid drunkenness. But my own feeling is that because a lot of people don't know their limit with alcohol, they should better to stay away. That's my interpretation of it. Okay, okay. Point well taken. Point well taken. Yes, yes.
The fruit uh, or the fresh. He mentioned drunkenness, not drink. So the Bible has a lot of interpretations concerning drinking. But as Methodists, that's what the Western feels that, as Doc said, if you try to take maybe a thought today, tomorrow, you go to quarter, then you go to half, then you become drunk. That's why he feels that no drink at all. You will not be tempted. The Bible, but the Bible allows. Yeah.
is shed wine. That's alcohol. And you should also remember that when his first miracle, he turned water into wine. He turned water into wine. So Jesus didn't stay away from alcohol. He drank it. But I'm sure he never engaged in drunkenness. He just drank a little bit. He knew his limit, so he wouldn't drink too much. And that's what I advocate for all of us. Stay away from alcohol because most of us don't know our limit. But if you drank a little bit, you are not violating the Methodist tenet. In actual fact, Methodists, we drink wine at communion, and that's alcohol too. So we can't pretend that alcohol is ipso facto bad for all of us in every situation. The situation that is mentioned at parties, if you are a software and go to a party and they give you Guinness, and all of a sudden you put the Guinness bottle in your mouth and you are drinking, everybody looking at you, that's not good. So that's why they said if you go to parties, weddings, and so on, don't do such. Okay, you're not showing leadership. You're giving bad example. Then all of a sudden, all your members are also drinking at that party. So stay away. Yes. Yes.
You don't know when to stop and you keep going. And it has been determined that
Yes.
those are a lot of risk factors. And to
Yes.
me, so I'm a very big advocate when it comes to no
Uh-oh.
drinking at all.
Okay.
Thank you.
Good. As a matter of fact, another thing you should need to know is that women tend to react worse than men with alcohol. They react worse. There is a certain enzyme in the stomach that breaks down alcohol when you drink it. Women don't have that enzyme, too much of it. They have less of it. So it's easier for women to get tipsy and drunk when they drink. Men may consume a certain amount, a woman drinking the same amount will get drunk. So there are differences between men and women too. And as Sister Paulina said, there are diseases that alcohol causes. And that is cirrhosis of the liver is caused by drinking. Cirrhosis of the liver damage is caused by, and there are certain dementing illnesses, brain fog, it's caused by too much alcohol. Alcohol is not very good, but my own feeling is that we should stay away from it, should stay completely away from it. But then there are also advocates who may say that, okay, you drink a little bit, but not too much, that's okay. My own feeling is what I've stated, that because we don't know our limits, you should stay away.
All right. All right. Thank you, Doc. Before we get to our brother Augustine, Obi question is there an OTC kit for the PSA test, or it is primarily through prescription?
Okay, the PSA test is ordered by the doctor. It's not an easy test to do and interpret, so it's not available OTC. It's for the doctor to order. And as I indicated, you have to be careful with this test because it is not specific for cancer. It can happen even the PSA test can go up, go higher than it should be when there is inflammation of the prostate, when there is urine infection. So it's only the doctor who can prescribe it and then interpret it for you. It's not OTC.
All right. Thank you, Doc. Our brother Augustine, your question.
All right, thank you, Doc. My question is very simple. Do you have to wait till doctor prescribe that test or you can also push for it, as you know the prevalence risk in the prostate. Do you, as an individual, can also push for your doctor to prescribe that for you, or you have to wait for the doctor himself to actually prescribe it for you? More so, what's your take about our Africa traditional herbs that people also claim that can also treat prostate cancer? Thank you.
Okay. Did you ask one question or you asked two? I didn't
I
quite
put
get
two questions now.
two questions.
One is for Africa traditional herbs that
Yes.
people believe can cure prostate, and then if you want the screening, do you have to wait or you have to wait for a doctor to prescribe that for you?
Do you have to wait for what?
A doctor himself
For the
to
doctor to
actually
order.
prescribe it, or you
Yes,
can,
yes.
as individual, can
Yeah, you
also
have to.
push for it.
Yeah, you talk to your you see, because the test is not specific for prostate cancer, you have to talk to your doctor, and then he would analyze your situation, your risk factors, and decide whether you are at the appropriate age to do the test. Okay, that is number one. Number two, when the test is done, it has to be interpreted, and it's based on certain factors which your doctor will talk to you about. And sometimes the doctor may even decide with you whether you want to have a test done at all. There are some people who go to their doctor, the doctor says, hey, you are 50 years old, you need to do PSA. And then the patient will say, Doc, are you sure that I need to do this test? The doctor will say, yes. And the patient will say, Doc, I'm afraid of prostate biopsy. If this thing comes back and it's positive, I might have to go to prostate biopsy. But last year, my friend had a biopsy and he bled, and he was hospitalized for 2 weeks. He was bleeding. He needed blood transfusion. So I don't want to do this. And the doctor said, you mean it? He said, yes, I do. So the PSA doesn't get done. So it's a discussion between you and your doctor to decide whether you need to do this or not to do it. Okay, that's it. You have to have that discussion first before the test is ordered. And then the doctor will tell you the appropriate way to do it. And regarding the local herbal treatments, yeah, you have a lot of potential in herbs, but I haven't been trained in herbal medicine, so I can't advise you about that. But I'm sure there are herbs out there that can treat prostate cancer.
All right.
All right.
Thank you. Any
Yes.
other
Follow-up
question?
one, if there's any chance.
Yeah.
Yeah, I was asking about the prescription because I'm over 50 and my doctor had never mentioned of it. That's why I was putting that question, that as individual,
Yeah,
considering the risk factor and everything, do we also have to bring it across so
yeah,
that we will be safe?
yeah. I think you have to, it's a discussion, When you go and see your doctor about some things, you need to have some discussion. And this is one area that you need a discussion with your doctor. First, to decide whether you need to do this, whether you are the appropriate age and risk for doing it. And then you tell you the complications of getting a biopsy, complication of treatment, and so on. And some people, because of those complications, they say, nah, I don't want to do this. And then the screening is never done. But if they change their mind, they could come back. But it happens. Some people refuse to have PSA tests done. And remember, President Biden, when he got to 70, he told his doctors that he wasn't going to do it anymore. He refused to do it. He said no. So it's up to you to decide. A lot of times it's up to us to make that decision.
All right. We will take one or two more questions and Any other question? I think, Doc, I saw one question, but I don't see it anymore. Somebody was asking the right time to sleep or something.
Yeah, I think I saw that too. Yeah, it is still there.
Oh,
What is the
okay.
best time to sleep? The best time to sleep is at night. It's as simple as that. It's not mystery. So when the night comes, you sleep. But make sure you sleep 8 hours. It doesn't matter whether you go to bed at 7, all right?
Oh,
You
okay.
go to bed, you sleep, you go to bed at 7 and wake up at 3 o'clock. That is enough time for you to have a nightful rest. Some people sleep at 10, and they wake up at 6. I think most people do that. Most people sleep at 10 and wake up at 6. If you are retired and you don't go to work, when you sleep is up to you, but you have to get your 8 hours. Does that answer the question?
I have one question.
Yes.
With
Please, yes, it's answered.
Doc, it's about food.
Yes.
Is it sweet after meals or meals after sweet?
What is it?
At times when you go to dining hall, so drink your orange before you eat, or after eating then you drink your orange. Is it
Oh,
sweet
okay.
after food or that? That's why I'm confused.
Do you eat your orange before you eat, or eat before you drink your orange? I mean, personally, I think it's okay to eat your fruit before you eat, because you need your fruit, okay?
Yeah.
Yeah. So once you put that in, because you need that, the rest of the food, maybe you get to half of the food and you are satisfied, and then you stop. Then you can't eat your fruit. So if you eat it before you eat the main meal, that is good. That is my personal opinion. I haven't seen
That's
anywhere in the literature that you should do that.
what do you say?
So he's right. You have to definitely eat your fruit first. And I know that if your fruit, once you eat it first, it works better than if wedi egu aduane so. So yes, you get a lot of benefits if you eat it on empty stomach than when you eat it after your food. And
Mhm.
like he said, definitely, main and so you would definitely cut down on the carbo and
Yes.
have the fruits in your system.
Yeah.
And see,
True.
yes.
Yeah. I
Eat
think
before you-
that is a good reason also.
And I also have a question, and I
Yes,
think
Colin.
it has all been on prostate, but this is just a general question, and I believe most people on the line may also it might answer some of them. Midian said, if you have blood pressure, right, and let's say you're supposed to take your medication in the morning and in the evening, and you forgot your medication, can you double dose? Ubetumi afa. And that DNA, no asa fetch na DNA ka ho and I say because we fee and a party and intino, it do a numerous of a numeric and bit me afa me no ni na aka ho ana.
Well, my answer is a no, because you don't want to double dose. Okay. The reason you don't double dose is the right amount for, let's say, your blood pressure is, let's say, 25 milligrams of losartan. You are taking 25 milligrams of losartan. The doctor does what he thought would control your blood pressure. Now you forgot taking it yesterday. And this morning, oh, I forgot yesterday. So now you're asking yourself, should I take yesterday's and this morning's? You are going to take 50 milligrams, and that can drop your blood pressure to a dangerous level. So I would say no. You forgot, you didn't take it, that's fine. Let it go and take today's dose.
Thank you.
Yes.
Another thing, another question on diabetes. Let's say I'm a diabetic, and I did not, mafa, ebi ene me fasting, right? And now say mindidi yakra, But then because my doctor said me making sure say me family ninety, now my family no ba me ndidi. Is that advisable?
No. When the day now forward do the insulin say, it will drop your blood sugar. Again, it's not a good thing. If you drop your blood sugar to less than 60, for example, it can cause you to feel dizzy. Some people have fainted because of that, and it can cause you to fall down and hit your head. You don't want to do that. It's better to have a little bit of elevated sugar than a very low blood sugar. So when the year, you have to be careful the way you take your medicine.
Yo, me that's it. My last question.
Mhm.
I'm diabetic. Na masori anapa. Is it advisable to walk barefooted as a diabetic? If not, why?
Is it advisable to
Walk barefooted. Me de me na CC form as a diabetic patient.
not to?
Metimi anante, how do you say it? Barefooted, meaning don't wear my shoes, I don't wear slippers at home. Menante form sa with me now. Is it advisable as a diabetic?
To walk?
Yes.
To walk when you wake up?
Now, what the
When
one ACC firm
you do an SEC form, it's so you're diabetic.
diabetic patient. Obetimia yasa now they are nante.
Who needs to see for my day?
And nante, like you are walking, but you don't wear any shoes.
Because you feel you're home.
Oh, you are home. Okay. Wait a minute when I ask Sarah Nanti.
Uh-huh.
Oh, okay, I got you. Well, diabetics, you advise not to walk barefoot, all right? Because so BB or carpet in want to say that will be an BB Saneko war. It might cause diabetic foot ulcer, especially those without any feelings in the foot, especially those who have circulation problems in their legs. It's advisable to wear something around your feet every time you get up. Walking barefoot is not advisable for diabetics who have problems with their nerves or with their blood supply to their feet and legs.
Thank you.
All
Bradford,
right.
I think you have one
Yeah,
person on that.
that will be our last question from Dory Yamson.
Okay, thank you, brother. Doc, please, my question is, if you are not a diabetic, right, and then you decide to go on fruit and vegetable diet, for instance, you eat fruit and vegetables morning and afternoon, and then maybe in the evening you take a balanced diet, right? Is it advisable because some people claim fruit has so much sugar, but
Sugar,
if you are
yes.
not a diabetic,
Yeah.
some fruit, if you are not a diabetic, is it
Yeah.
advisable?
Yeah, it's okay for diabetics to eat fruits and vegetables, but because the sugar in those fruits, are not the same as the type of cane sugar mixed in soft drinks, for example. Soft drinks, they pour in sugar and all those things in there, and it can raise your blood sugar. But the sugar in fruits and vegetables are complex sugars. They have to be broken down. So it takes time for it to enter the bloodstream. So it's okay to eat fruits and vegetables for even when you are diabetic. Making sure that you are monitoring your blood sugar levels. And that is the case even when you are not eating those things. You have to monitor your blood sugar. But even when you're not doing it, I would say that because the sugar in the fruits and sugar in vegetables are complex carbohydrate sugars, it's better to eat them, all right? Because it takes time to digest those things and then for it to enter into your bloodstream to elevate your blood sugar. So it's okay. But not to drink fruit juices, the bottled ones, preserved ones, or drink soda. That is also laced with sugar. That will raise your blood sugar very high in a short period of time.
Okay. Thank you. But for instance, if you put a little bit brown sugar, for
Mhm.
instance, or brown sugar or any sugar at all, and if you having a porridge, right? Either rice porridge, awuza cocoa, them, and then you put a little bit of sugar, not to exceed that weight.
Mhm.
I mean, is it advisor? Because some people claim that it's not good at all, but the sugar, they've asked us to eat sugar. It's there for
Yeah.
us to eat. You can't eat Gary soakings without sugar. Some people like it.
Yes, yes, yes. You see, when you were young and there was no problem, no disease, we ate whatever we had, okay? But when you become older and you have diabetes and all those kinds of things, we are more careful. So being careful is the mantra now. So if you know you are diabetic and your blood sugar is not well controlled, it's better not to pour in the sugar and then make it tasty, you know. And a lot of the sugars that we eat is from habit. You know, I like sugar too, but I think it's because of habit. I eat certain things habitually, and because it's habit, I do it. But if I train myself that, okay, I'm diabetic now, and I shouldn't be doing what I used to do, every day when I change, it will gradually get to a point that I can tolerate no sugar. It takes 21 days to be able to go from taking sugar and no sugar, 21 days. So if you're diabetic, knowing that your blood sugar is not well controlled, avoid the sugar and try it and try it and try it. In 21 days or so, you arrive at the place you want to be.
But if you are not a diabetic, it's okay to eat a little bit, right?
Yes, if you're not a
Okay.
diabetic, it's okay because the body controls the sugar. See, when you
Oh,
eat sugar, it goes into the blood, all right? And the blood and the body has systems available to control the blood sugar so that it doesn't go way up. The body produces insulin, and insulin is able to keep it down. If you don't eat sugar and your blood sugar is low, there's also a system in the body that raises it up. So the blood sugar is left in a certain range. And whether you eat or don't eat is in a certain normal range for us. So it's okay when you are not a diabetic to eat sugar. The body
thank you very
would
much.
take care of it for you. But if you are
Thank
diabetic, because of the derangement in your hormonal system, then you are going to have problems. So if you are diabetic, you have to be very, very careful about sugar.
All right. Thank you very much, Doc. Minim say nke mu bebree ɛda so ɛwɔ question ne ade but yɛmbrɛ no nti yɛde bɛhyia daten sɛ Antipaulina bɛtumi ama doctor number available na berɛ bia no sɛ wowɔ question bi a watumi afrɛ na one-on-one ɔne wo akasa. Nti baabi a yɛaduru bɛfrɛ Antipaulina na ɔde aseda ama doctor for this good presentation given unto us.
Thank you, Brother Alfred. Yeah, Dr. Amayati Niyomepi. So we just want to say thank the Lord. We want to thank the Lord for making this day possible. Amayetimi aba na yetimi nyina abishia wa ahoma esu na yeti Doc Asamti Eradi Dawase. Our next thanks go to our bishop, who actually allowed us to make this possible. I know it says one part of the 190th anniversary on Health Week, but it was Bishop who actually initiated. So Bishop Yedawasi Osenie de bia o ma ye kwan na yetimi eba ahoma so betie ye pomodi ho ade. So thank you. And then I just want to also thank our late chair. I saw both the past immediate acting chair and acting late chair and our elected lead chair, both of them on T. Thank you for coming to support us. Our Senate Secretary, our Minister Son, Nyami Onshira Munyinase de Biamo best supporter. But our real appreciation goes to our doctor. Dr. Robinson, thank you. I know it was last minute, I
Yes.
just called you last week, and he told me, say, see, I had retirement to into my but he just took the initiative. He said he will come. He availed himself, and I make an intimacy. Since our retirement, ahoɔden sɛnea ɔbɛtumi de ayɛ n'adwuma na de bi ayɛfrɛ wo a na waba abɛka sa akyerɛ. So thank you. I pray that he replenish you 100 times for anything that you've lost, that he will continue to bless you and guide you in everything. Send you to me and Ejima. And then our other thanks goes to our bishops. Our Bishop Warne, our minister's wife, our Sophomore Reform also. Thank you all the time for coming to support us. Our next thanks goes to all the Yaya members. And this will not be possible. I also saw our sisters and from United that are also on. And I know some Brokenites are on because we posted it on that platform. So thank you all for coming to listen. I know for all that we've heard, especially Memano, Ayana Yunum say Montampe, some for checkup. And so this one actually is for our men. And I'm so glad that he chose this topic. Treatment. I know we promised that we'll have an open forum, and I hope we will do that again. And so I'm taking this opportunity to say thank you all. The only thing I'll add is that I know Bishop Becca this week is Health Week, and so we are hoping this Sunday all the social services team, and I know with Bishop Mayesene letters come superintendents every society we are hoping will have a health talk, and we'll do a lot of fundraising for health. Inti mesre say moma nyina enti sene be ya yebetimi de report Papa Akko Connectional. So thank you very much, Brother Alfred.
All right, thank you, Auntie Paulina. Baby Adri announcement, Brother Martin, and as a Senior Secretary was over to me and my announcement.
Well, thank you very much, Brother Alfred. I said, Sister Paulina Dika can Yadamunina Masi say and raise so maba. Maba Manaya Fefe, Nayempese, Besu Haya every Thursday, 9 to 10. Your high ball empire ama diocese ehun hia papa nti esremu p edru Thursday anwumra program bia ni honum empire ene ball ama diocese ama yeni ankasa yehun said ye betini atransi eye ti esremu p Thursdays no ehia ye bebrebe ye say baba be ball empire ni ahwesre erade akwantre. Nti Thursday bia ye wo ha ye bompaye ye da masese mo beba ne nyina ya bom na ya hwe erade anim every Thursday. With this said, no, next week Thursday 9 to 10 ye wo ha ye bompaye momra ne nyina ye mompaye. Thank you all. Brother Alfred.
All right, thank you very much. Baby Adri, Mama Bishop na one my closing prayer and benediction. Papa Odaroma.
Thank you, Brother Alfred, for being the MC for today's program. You've been a wonderful MC, and I love the way that you do your things. Dr. Bob, you push down, Papa.
What do I say?
I do say, you push down. But I call a heaven language, so don't worry. Let me comment. I will not stop saying that among the Jesus' disciples, there was a physician. Yes, it's not for no more German, not doctor. And I don't know why people are running away from health talk, but rather allowed to pray. Bono say it's wrong. we need to educate people on this. Prayer is good, as well as health talk also good. So we are na bompire, yeah, it can be healed, but I have to go to hospital. Maybe I should one kwan and I'm bunti young cop hospital bompire. Then they will die. And what be evidence in those be keep on educating people that come listen to the health talk. Then you pray so against it. Then you'll be healed. But prayer alone, a time can heal, but time cannot be healed unless you see a doctor. I mean, I'm going to me dear. I show no more enye. So when you about no for our hands, I know it's only how can you use the leaf to heal, unless somebody who has at the profession who can know better. And Timpa Choyama, Mount to say, but you have talker. You should come your numbers. 124 is woefully inadequate. Woefully inadequate. 24. And I am much. Sanka say be a shank of online as well. Can you see? We see people online. Commission. But health talk was also commission on prophecy. Whatever came out from doctor, it's a prophecy. You should know that. My comment again. So please let us educate our members, our people, that when it comes to health talk, come to numbers and come and listen to whatever is coming out. The important issues is really disturbing men. The men are suffering the issue in the way that our doctor handled this program. Done very well. So it's our prayer that God will continue to protect and guide us and give us larger people to just know what is happening in our body, so that we can be strong as well as we can also pray. When you are sick, you cannot pray. You have to be healthy, strong. Then you can clap your hand, you can jump, and you can pray, shout. So let's also take health talk as very important as prayer and the word of God. If you want to grow into maturity, health is also among God. Growing into Christian maturity by prayer, by the word, fellowship, and by hearing to the health talk. Your body, you have to listen to your body so that the body also can be strong, so that you can grow mature. So, per se, I am paibo, a quenching, my brother, na apomudiri ho asem bo mo wayezem nti yemfranka ho na next time bia no there's any health talker yamre numbers so services yamamo adwuma pa a maye ne nimra maye nkoso na munyasa emfama ye because owo na do so Ghana fom dodo. The death is too much to Ghanaians, because we don't take our medications seriously. Yani yepe ntema yetumi anya hoden no entena hanche na me Israel bacho ma empire adumura se yenyawa yentum brayebo senka ye ho a ehwea nyame onye ye etias wo mu ye de yawura hye amenyim engwa hye biara da it was wodo na yemia it was in my hand na yitwaje hen wa kwanyina mu yezi free efembem nyina nyame awjana montata ye bompa esra wo de bra dwu loko na ewie yi amode bia be ma bia no ye ko wura bosunku from July na woma akodo ya som ye de ya bopo de wichin ye bedi ye bia ye ko onkote ye obenanto nti boy kwa ma hen na so hen adosoa na me akomanto ye me nwenja brabom akodo international yension anofan boy ho ban bra ya da nipa da ne na so gwa agba no so okay ye ho da yensro musuna se bia anofan guide potato for that through night amo chiosa no pa e de aseda e da mon na me na dom na me nshira me no bambo na me yasa my yentra no fun grace, love, and mercy and healing of God be our portion this night. For the Son and Holy Spirit. Amen.
Amen. Amen.
You want to put up
Bishop, nyame enhyira webree. Abusuafo nyame enhyira wo bibia nyame yɛ adom a sɛnea brother Martin ka next week nso yɛbɛsan ahyia. Have a good night.
Good night. Thank you. Thank you. Thank you, Brother Alfred.
My
Thank you.
Alice, God bless you for a wonderful introduction. Have a good night.
Good night.